Hi, everyone. I'm Dr. Swanson alongside Dr. Kubik. We're from KSB Foot and Ankle, and we'd like to welcome you to this evening's KSB Wellness presentation. We'd like to thank Aaron Fox and KSB Wellness for putting this on this evening as well. We thought that with summertime and activities coming up, it would be appropriate to discuss some common running injuries. And so we actually have a list of things we'd like to cover tonight, and hopefully we can give you some advice to help everybody stay safe and have fun this summer. So we will cover some running injuries. We'll touch on footwear, some skin care, common skin conditions, and then when to seek medical attention. So here are a list of some of the more common running injuries that we see. You can see there's quite a list here. Varies from heel pain to sprains, tendonitis, metatarsalgia, which we will get into, and then we'll touch on stress fracture and fracture, and then development of calluses, pre-ulcers, shin splints, and then runner's toe as well. So first is plantar fasciitis, one of the most common conditions that we see. This presents as heel pain, typically on the bottom of the heel. It can present in the arch as well. And patients typically have pain with their first steps in the morning, and then that pain may slowly subside and get better. They also experience increased pain when standing after sitting for prolonged periods of time. What do we do to treat this? Well, we typically start with what's called RICE therapy: rest, ice, compression, elevation, and some type of anti-inflammatory. Steroid injections can be helpful if appropriate as well. Physical therapy and stretching exercises is going to be one of the most helpful things as well. Our tissues contract and get tight whenever we sit and lay, and for example, when we're sleeping overnight. And so if we can keep those tissues as flexible as we can, that can help this condition to resolve and hopefully prevent from coming back. And also supportive shoes and orthotics. Next is foot and ankle sprains. So sprains involve stretching and tearing of ligaments, and this can happen in a variety of locations in the foot and ankle, and there's also a variety of degrees and severity as well. Some of the symptoms: pain, swelling, bruising, and difficulty bearing weight on your foot. Treatments include initially a period of time of immobilization, or we protect the foot and ankle with some means of like a splint, sometimes what's called a cam boot, or one of those black boots that you're able to walk in, but does lower the pressures when you're walking. Once again, RICE therapy, anti-inflammatory. Physical therapy can be helpful. And then once we see improvement, we'll slowly increase activity. Once again, supportive shoes and orthotics. We'll see a trend here with supportive shoes and orthotics being very consistent, along with some of the other treatments listed there as well. Next is tendonitis. So what is this? This is inflammation of tendons. This can also occur in a variety of locations in the foot and ankle. A few listed there are some of the more common ones we see: Achilles tendon, which is in the back of the heel, the peroneal tendons, which is on the outside of the ankle, and posterior tibial tendon, which is on the inside of the ankle. Symptoms, once again, pretty similar to the others that we've listed: pain, swelling, and difficulty bearing weight. And the treatments are also similar to previous condition. So we may need to take some time to immobilize the extremity, RICE therapy along with anti-inflammatory, physical therapy, and then once we feel better, slowly increase activity, and always continue with supportive shoes and orthotics. Metatarsalgia. So what is this term? Well, this term is used to describe pain that presents under the ball of the foot. And this occurs when there's increased pressure to the metatarsal, what we call metatarsal heads, or the knuckles in our forefoot. If we're on our feet for longer periods of time or overuse, that can cause this condition to develop. Also, different biomechanical conditions can cause this. Hypermobile first ray. What does that mean? Well, that involves your great toe or your first toe, and along that whole inside column of your foot, sometimes there is increased range of motion in this area of the foot. And so the amount of weight that is supposed to be supported by your first ray, it does not do that. And so it transfers it over to the second, maybe the third and the fourth, or even the fifth, and causes pain underneath your metatarsal heads. Another thing can be biomechanical in regards to a long second metatarsal. If that metatarsal is longer than the first, then more pressure is presented under that second metatarsal, causing pain. Also, having a tight Achilles tendon can cause the foot to be in a more plantar flexed or down position, and this also increases the pressure under the forefoot. A tight Achilles tendon is the most deforming force of the entire foot and ankle. So when we have this condition, it can make everything else worse. Treatments, a lot of the same similar treatments as before: rice therapy, anti-inflammatory, stretching exercises, along with physical therapy. And then once again, we slowly increase activity as tolerated when appropriate, and always utilize supportive shoes and orthotics. All right, stress fracture and fracture. So these both can present pretty similar in symptoms. Pain in the foot or ankle in a variety of locations. If there is no enticing injury or traumatic event, then you could be developing what's called stress reaction or a stress fracture. Stress reaction would be described as a deep bone bruise, and a stress fracture is a fracture that has resulted from this deep bone bruise and weakening the bone from overuse and causing injury. If there is a known injury, then we typically describe this as a fracture. Swelling, bruising, and difficulty putting weight on the foot or ankle are common symptoms. Sometimes patients are unable to put any weight on their foot as well. So what are treatments? Treatments typically involves a time period of immobilization. Obviously, this will depend on the severity, but typically 4 to 6 weeks can be expected. Rice therapy and anti-inflammatory. Vitamin D is very important in regards to allowing our body to absorb more calcium. And so if we have optimal vitamin D levels, we can heal stress fracture and fracture more efficiently. And so it's a good thing to look into vitamin D levels, and we can supplement appropriately. Supportive shoes and orthotics, and then slowly progressing activity when we're ready to do so. All right, I'll turn it over to Dr. Kubik now.
Thank you. So shin splints is another common thing that we see, especially over the summertime when people really increase their activity, especially like running. What this is pain along the shin bone to the front of your lower leg. It's typically an overuse injury. It can be both at the front of the leg as well as the back. But ways that you can treat this at home, so just modifying your activity. If it hurts you, if it is uncomfortable to run, then to kind of cut back on that activity. Maybe don't run for as long of periods of time or walk longer. Stretching exercises, physical therapy, things that Dr. Swanson has mentioned for the other problems that we have talked about earlier is also very helpful. That rice therapy, so the rest, ice, compression, and elevation is also really helpful. Icing for this is really good. You can even freeze a water bottle and roll it kind of along the front part of your leg, and that can help with that as well. Making sure that you're wearing the supportive shoes and orthotics to help support your foot structure can help prevent these from occurring too. Other things that we typically see are calluses, pre-ulcerative calluses or runner's toes. So kind of what those are. Calluses develop from areas of increased pressure. So you'll notice it kind of as like a thickening or a hardening of your skin. It can be in the ball of your foot as well as other places in the foot. This can be something that should be addressed because it can create an extra pressure of that area, which can then lead to a wound or an ulcer. So things that we can do to treat that is just to make sure that your foot stays moisturized, that the callus doesn't build up too much. We can add some offloading pads to the area to help take off some of that extra pressure to the area. Again, wearing the supportive shoes and orthotics. So for runner's toe or a nail that becomes darkened, kind of like this picture here, That is due to repetitive trauma, such as running or even walking for long distances, walking downhill is causing that repetitive trauma to the nail itself and can cause a blood blister underneath the nail. This can be very painful. So ways that we treat it, we sometimes will drain that blood blister underneath the nail, and we can potentially remove the nail depending on how involved it is. If the nail is removed, it can take anywhere from 6 to 12 months for the nail to regrow itself. But the biggest thing to prevent this from happening is just to make sure that you're wearing proper fitting shoes. We don't want them to be too tight because that can cause extra pressure on the toes. But if they're too loose, then it causes extra slipping of the foot and can add to that repetitive micro trauma. Picking a stable shoe is really important. So tennis shoes are great to wear, making sure that it's not too flimsy, that you can't bend the shoe in half. That's kind of things that we look for when we're picking a stable shoe. I know that it's really nice to wear sandals and flip-flops in the summertime, but making sure that you have the appropriate shoe for the appropriate activity is really important. If your shoes do get wet, like if you're down by the lake or if you're out in the yard, making sure that your shoes dry out before you put your foot back in it, that can help prevent getting fungus in your getting fungus in your shoes. Avoid going barefoot is also something that's really important. You want to make sure that you're not going to step on anything. We don't want any splinters or any rocks getting in or puncture injuries to your foot. Wearing socks that are moisture wicking are going to help kind of wick away the sweat or the excess moisture is also important to choose. Some skincare for your feet. Sunscreen. I know sunscreen is very important for all over the body, and the foot is an area that's typically missed. So making sure that you have SPF 30 or more. We don't want to sunburn on the top of our feet or anywhere else. Bug spray is also very important whenever you're going outside. When you're spraying the rest of your body down, make sure that you get your feet, especially if you are wearing open-toed shoes. A moisturizer is really important to help prevent any cracking of the skin. A vitamin E oil or a vitamin E that is in the moisturizer is something to look for. Just make sure that when you are applying the lotion that you're avoiding putting it in between the toes, because that can lead to too much moisture. So it's kind of a balance between enough and too much. Keeping yourself hydrated if you're going to be out in the sun for long periods of time, making sure that you are drinking enough water. That can help with your whole body as well as your foot health. Making sure that you are checking your feet daily, especially if you do go barefoot, making sure that you didn't step on anything, you don't have any wounds or cracks in your feet is something to pay attention to. And if you do have any open sores, avoiding any lakes or ponds or any dirty water is something to watch out for. Some other common summer skin conditions that we see, so blisters, athlete's foot or a foot fungus, plantar warts, sunburns like we were talking about, you can see here, or poison ivy or poison oak are things to avoid.
All right, so when do we need to seek medical attention? Well, any signs of infection is definitely something that you would want to get further evaluation for, meaning pain, redness, any drainage from open wound, or feeling ill, nausea, vomiting, fever, chills, definitely seek attention. Any puncture wound, whether that be stepping on a nail, wood, glass, or anything else. It's always important to make sure you're up to date on your tetanus immunization as well. The main thing to keep in mind with puncture wounds is if something punctures the skin, there may not be something that is visible on the level of the skin, but underneath you could be developing a deeper infection. So that is why it is important to always seek attention. And with any injury or trauma, if you do have pain that has been prolonging or worsening over time, increased swelling or bruising, and definitely if you cannot put any weight on the foot, that is a sign that you need to seek medical attention as well. Well, good. Well, that concludes our presentation for this evening. We hope that you found this information helpful. And if you have any concerns of any of those conditions we had mentioned or any other questions, you can always leave us a question down below. We'd be happy to get back to you. And we also could get you scheduled for an appointment for evaluation if needed as well. We hope everybody has a fun and safe summer, and we'll see you next time. Thanks again to KSB Community Wellness for putting this on tonight, and everybody have a great night. Thank you.